Are you ready to get rid of the pain in your back and start enjoying life pain-free? Well, this is right where we get started, because on this DVD, I'm going to take you through level 1 of the DABS Accelerated Back Care System. The personal trainer and physical therapist who helped me develop the system, Tiffany Hayden and Joanne Colburn, and I are going to lead you through the workout. We're going to do each of the exercises as you do and show you how you should do them. Watch closely and do what we do. We will be doing this workout for 14 sessions. Now, you may be able to get finished with all 14 sessions simultaneously in the first 2 weeks, but this is not a race. Just do what Tiffany, Joanne, and I do, and we'll start to become pain-free. So let's get started. The first exercise is called the standing foam roll stretch. So go ahead and grab your foam roller and put it behind the small part of your back. Put your arms around it so your forearms are kind of resting on it. You're stretching out the front chest area, and put your legs shoulder width apart. And when I say go, we're going to arch backwards. Just do it nice and comfortably. Don't do it to the level of a lot of pain, just mild resistance at the end. Are you ready? We're going to hold for 3. Ready? Go back. Good. Arch your back. Hold for 3, 2, and 1. Excellent. Take a little breather. Make sure you've got your spine as neutral. Ears over your shoulders, over your hips, belly button up and in. Are you ready? We're going to arch back again. Arch back. Good. Hold 3, 2, and 1. Excellent. Okay, one more time. I'm going to arch back. Go ahead and arch back. Hold 3, 2, 1, and back. Excellent. That's a really good exercise to warm up the back and keep it loose, especially for those with arthritis. Okay, the next exercise is going to be about balance. Great for proprioception, the brain communicating with those tiny multifidi muscles of the back. So go ahead and stand, feet a little bit spaced apart, and if you need help on this balancing, do what Tiffany does, and she's going to touch the wall or a foam roller. And what you want to do is stand on your right leg, lift your left leg, hold for 3, 2, 1, and down. Go ahead and switch now. Stand on your left leg, raise your right leg. Keep your spine neutral. Ears over your shoulders, over your hips. 2 and 1. Switch to the right leg. Good. 5, 4, 3. Keep balancing. 2 and 1. And switch to the left leg. Good. 5, 4, 3, 2 and 1. Or last one over to the right side. 5, 4, 3, 2 and 1. And last one on the left side. Keep balancing. Keep that spine neutral. 2 and 1. Very good. Okay, not too bad. All right, the next exercise we're going to do, knee to chest. Go ahead and lie on your back. Great stretch to do first thing in the mornings. Lie on your back, keep that back flat. Belly button up and in. Now go ahead, and what you're going to do is straighten out your left leg. Now you're going to bend and pull up your right leg, grab a hold of your knee. Tiffany will demonstrate by grabbing hold of her thigh for those of you knee problems. And pull up. Good, and hold. Keep it stretched for 10, 9. Keep that left leg flat. Don't let it come up. 7, 6, 5, 4, 3, 2, and 1. Go ahead and drop that knee down and flatten it out. Pull up your left knee. Go ahead and grab a hold of it and pull up for 10, 9. Keep that right leg flat. 7, 6, 5, 4, 3, 2, and 1. Great exercise. Okay, this time we're going to grab both your knees. First, pull up your right leg. Now pull up the left and pull up tight and hold. 10, 9. I'm going to say my favorite mantra. Say it after me. I feel great all the time. I feel great all the time. Say it again. I feel great all the time. 2 and 1. Excellent. Bring it back down. Stay on your back. Keep your knees bent. Next exercise is called supine crossover stretch, a great stretch for flexibility of the lower back. Now what you want to do is you want to take your right leg, put it over your left knee. Tiffany will demonstrate by keeping both her knees bent to make it easier for those who may have difficulty with this. Put your right arm out for balance and kind of twist over to the left. Good, about 45 degrees. Hold. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1, and bring it back. Excellent. Now take the left leg, put it over the right knee. Again, take your left arm, put it out for balance. Tiffany will keep her knees bent together and twist over to the right, halfway. Okay, 10, 9, 8. Let's say our favorite mantra, I feel great all the time. Say it after me. I feel great all the time, and bring it back. Nice. Excellent. Put both feet flat on the floor again. We're going to do one more time. Put the right arm out. Take the right leg, put it over your left knee, and twist over. 45 degrees. That's great. Halfway. And hold. 10, 9, 8. I feel great all the time. Say after me and mean it. I feel great all the time. And 2 and 1 and bring it back. Awesome. Last one of these. Put that left arm out. Put that left leg over the right knee and twist over to the right. Good. Hold. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Nice. All right. Bring it back. Okay, take a deep breath in and out. All right, our next exercise is going to be our hamstring stretch, assisted with your rubber band that came with your kit. Go ahead and grab that and put that underneath your foot. Tiffany will demonstrate by putting this underneath her right thigh, because to make it easy if you can't quite reach that far. And go ahead and lay on your back, keep a hold of the elastic, and when I say go, we're going to lift our leg up. You ready? Go, lift it up. Kind of lift it up using your leg and your arms. Keep that knee a little bit bent. Keep that left leg straight. All right. Hold. 8, 7, 6, 5, 4, 3, 2, and 1. Drop it down. Nice. All right. Rest for a minute. Take a deep breath in. All right. We're going to lift that right leg up again. You ready? Lift up. Hold it nice and tight. Keep that right knee a little bent. Keep that left knee straight. 7, 6. I feel great all the time. I feel great all the time. 2 and 1. Drop it down. Nice. Let's switch this elastic band over to our other foot. Grab a hold. Lay on your back. When I say go, lift your left leg up. Keep your right leg straight on the floor. Are you ready? Go. Lift that left leg up. Keep that right leg flat. Don't let it come up. Good. Belly button up and in. 7, 6, 5, 4, 3, 2, and 1. Bring it back down. Take a deep breath in and out. Excellent. Ready to bring it up again? Bring it up. Good. Keep that left knee a little bent. Right leg's flat on the floor. 8, 7. I feel great all the time. Come on, say it after me. I feel great all the time. 2 and 1. Excellent. Nice. Okay, come on back up. The next exercise we're going to do is called the basic abdominal crunch. Now this exercise is great for the abdominal muscles, which help stabilize the back. Go ahead and lay on your back. And what we're going to do is we're just going to come up just a little bit and we're going to touch our hands to our knees. Tiffany will demonstrate by holding the back of her head in case you have neck problems. Are you ready? Come on up, touch your knees or point your elbows to your knees and back down. That's 10. And another one, 9. Come on up. 8 and up. 7 and 6 and up. 5, 4, 3, 2, and 1. All right, go ahead and rest back. Take a deep breath in. Boy, did you feel those abs burning? You're going now strong. Okay, we're going to do another set. Are you ready? Put your hands out in front. Get ready to touch your knees or point your elbows at your knees and come up about 6 inches. Let's go. Good. 10 and 9 and 8 and 7 and 6 and 5 and 4 and 3 and 2 and 1. Excellent. Great. Okay, come on up. The next exercise is my favorite. It's called the child's pose stretch. A great exercise to do whenever your back hurts. You can do it any time of the day. Go ahead and get on your hands and knees. And what you're going to do is you're going to sit on your heels back as far as you can and reach with your hands as far forward as you can. Tuck your chin down. Excellent. Keep it holding down there for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Come on back up on all fours. And we're going to go back down again. Are you ready? Back down, sit on your heels, reach far forward as you can. Head down. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Come on back up. And we're going to do one more time. Are you ready? Sit on your heels and reach forward. 10, 9, 8. Say after me, I feel great all the time. Mean it. I feel great all the time. 2 and 1. Excellent. Very good. Our next exercise is a little trickier. It's called the hip flexion stretch. For this, you'll need your foam roller. Go ahead and grab it. Put it out in front of you. Take your left leg, put it as far forward as you can. Put your right knee on the foam roller. Now keep your spine neutral. That means ears over the shoulders, over your hips, belly button up and in. And when I say go, we're going to roll or translate forward. Keep your posture upright though. I'm going to feel it in the quads and in the hips. So are you ready? Roll forward, put that knee over the ankle, not past it. Feel it in the right hip, hold it. 5, 4, your left quads might be shivering a little bit. That's fine. 2 and 1, bring it back. Excellent. Whew, that was tough. Take a deep breath in and out. One more time. Are you ready? Roll forwards. Keep your spine neutral. Good. Now hold it. Feel that right hip stretching. Arch back a little bit if you have to. 2 and 1 and come back. Nice. All right, let's move over to our other leg. Put your right leg as far forward as you can. Left knee on the foam roller. Are you ready to roll forwards again? Ready? And roll. Excellent. Feel that in the left hip. Arch back a little bit. Feel the quads working on the right leg. 2 and 1 and come back. Good. Are you ready to roll forward again? Take a deep breath in. And roll. Nice. Hold it. 5, 4, 3, 2, and 1. Excellent. Very good. Okay, now we're going to move to what's called, this is kind of a fun name, the cat-camel stretch. So grab your foam roller again. This time we're going to go on our hands and elbows on the foam roller. Tiffany will demonstrate this without a foam roller to make it easier for those who have difficulty with this. So put your elbows on the foam roller, stick your rear end out, and when I say go, we're going to roll the foam roller towards our wrists, and we're going to arch our back towards the roof. Are you ready? Go. Good. Roll towards the roof. Drop your head down. Hold. 5, 4, 3, 2, and 1. Now, drop that belly down to the floor all the way. Good. Lift your head up as far as you can. All right. Hold it. 3, 2, and 1. Good. Now roll back onto your wrists. Push that arch back up towards the roof. Good. 5. Drop your head down. 3, 2, and 1. And roll forward onto your elbows. Drop that belly down. Good. Hold it there. 5, 4, 3, 2, and 1. Now roll back towards your wrists. Belly button towards the roof. Back towards the roof. Let's go. Drop that head down. 5, 4. Say after me, I feel great all the time. And roll forward towards your elbows. Lift your head all the way up. Nice. Drop that belly down. 5, 4, I feel great all the time. And now, one last one. Roll towards your wrist. Keep your back arched towards the roof. Hold. 5, 4, 3, 2, and 1. Last one. Drop that belly down. Good. Roll towards your elbows. Head up high. 5, 4, I feel great all the time. And relax. Nice. Okay. Good job. Next exercise we're going to do, we're going to need our ball for this. This is kind of a fun exercise. Go ahead and grab it. This is pretty easy. Kind of warming down now. You sit on your ball. Very important. Keep your spine neutral, meaning ears over your shoulders, over your hips. Put your hands on your knees, and we're all just going to bounce. This is the fun part. And this is a little bit of balancing in here. This balancing that we're doing coordinates the little multifidi muscles in the back. Keep that belly button up and in because those two have to work together. And just by doing this, the little movements that you may have from side to side, front to back, will be enough at this point to just get those tiny multifidi muscles to function. And they're the tiny muscles in your back that are firing back and forth, and they help coordinate the three-dimensional movement of your spine. Okay, so keep bouncing, and you're going to keep feeling it in the abdominal muscles. Keep the belly button up and in, and we're going to move on to the next exercise. It's called the recovery position exercise. So what we're going to do is we're going to stop here, stand up, put this ball in front of the mat, and we're going to lie back on our backs and put our legs up on the ball. You can use a chair for this as well. This is a great exercise if your back is ever in pain and you just need to rest it. Put your hands at your side and just kind of lay here and relax that back. Take a deep breath in and out. Nice. What we're going to do now is we're going to add a pelvic tilt in here. We're going to take our pelvis and we're going to flatten out the curve of our back. Are you ready? Flatten it out, rotate that pelvis, push that belly button towards the floor and hold. 5, 4, 3, 2, and 1. And relax your back. Let it just lift up naturally. Just rest. And we're going to do it again. So go ahead and push that belly button towards the floor. Rotate your pelvis back, flatten out your back, hold. 5, 4, 3, 2, and 1. And just relax that back. Deep breath in and out. And we're going to do it one more time. Are you ready? Rotate that pelvis back, flatten out the curve in your back, hold it. 5, 4, 3. I feel great all the time, and relax. Great. Okay, deep breath in and all the way out. Good. Okay, these two are going to stay in this position as you will. This way you can just rest your back, relax, and meditate. This will probably be the best part of your day. How do you feel now? That is a DABS Accelerated Back Care System Level 1 workout. Keep it up for 14 days. Now remember, if you're sore, uncomfortable, or feeling pain, take a day off and wait until the pain goes away. Then resume again until you have done this entire Level 1 system 14 times. Only then should you move on to Level 2, which we will cover in the next DVD. Your back should already be feeling better, and if you continue with this system through all 3 levels, you're going to be amazed, so stay committed. You can relieve the pain in your back and you can live pain-free. So please stick with the system. Great job, and we'll see you tomorrow.